Hello, everybody. We're going to get ready for our next session. I am Carrie Harrisine with the Consumer Technology Association, and I'm really excited for our next session on bridging the gap of care. So please join me in welcoming our moderator, Legia Ricciardi, and she'll introduce the rest of our panel.
All right. Hello, everybody, and welcome. The lights are very bright up here, so we can't really see you. I can see you're smiling, which is great. So I'm Legia Ricciardi. I'm the founder of Ada Rose, which is a wellness company, and I've been in digital health for about 20 years. And I am thrilled to be speaking with this group today on the topic of access to care and digital equity and generally bridging gaps in healthcare, which I feel very strongly about. I will say I was scrolling through social media this morning, and a lot of the feeds I follow are related to healthcare, but I was kind of like going through Instagram. Somebody who was not in our field at all was complaining about a process with healthcare, and she was complaining like, why are people focused on all these issues like diversity and inclusion when really I can't even get anyone to just do this simple thing? And I was like, oh my, there are some real issues that we need to address here, so perfect timing. So without further ado, I want to introduce my panelists. I'm going to just kind of tell you their names, and then they can tell you a little bit about who they are and what they do. We've got Jennifer and Neil and Karina here. Jennifer, do you want to just give us a quick hello and kind of tell us about you and what you do?
Sure. Thanks so much for the opportunity to be here. So I'm Jennifer Schneider. I'm Chief Executive Officer and co-founder of Homeward Health. At Homeward, we're re-architecting the delivery of health and care in rural America. And so one of our approaches our two approaches are to align economic incentive and take on total capitation for people living in rural America, starting as an in-network provider for Medicare-eligible individuals. And we deliver the services on a scalable technology platform to be able to do this at scale across rural America. We know rural America is not small, it's large. It's 20% of our total population, and people living in these markets have very decreased health outcomes.
Indeed. Thank you, Jennifer. Neil?
Yeah, great to be here. Thanks so much for spending the time for all of you out there. I'm Neil Botcher. I'm Deloitte's Future of Health leader. You all likely know Deloitte, world's largest health advisor, and so I own the narrative for where health is going on behalf of the firm. We've been at it now for 5 years, and CES is my favorite show because you're seeing the transformation to this future real time, year by year, and really powerful incremental steps. The underpinning of our narrative is the conversion from a sick care reactive system to one that is more early engagement, early detection, early intervention. And so much of the technology you see emerging and so much of what the folks on this stage are doing is actually moving us earlier into disease, which drives down costs, drives up outcomes, and in general allows folks to be healthier. So we're really committed to that. Thrilled to be here, excited to talk about this.
Thanks, Neil. Karina.
Sure. Hi, everybody. I'm Karina Edwards. I am the CEO of Quill. We are the digital health joint venture between Comcast, NBC Universal, and Independence Blue Cross. And we are focused on age tech. And it's it's been a phenomenal year by launching an ambient sensing-based product to allow seniors to age in place, but more importantly, empower caregivers to navigate and support and get peace of mind that their senior is safe. And so it's been a great adventure, and I'm thrilled to be on this panel.
All right, so to kick this off, I want to sort of speak to this person out there on social media, I know there are many, who are essentially saying maybe diversity, inclusion, and equity and access to care is not that big an issue. How can we counter that? Why do you guys care? Is this just a nice to have? And how does it relate to the current world that we're facing, our environment, which includes obviously some big social and economic changes and trends? Why don't we, at least to start, we can do this kind of in order if you'd like. Jennifer, why does this matter to you?
Very personally for me, I am a physician by training and got into healthcare to make a difference. And what we've seen is we've made leaps and strides in many areas of healthcare delivery and medicine, and in others we're still very, very far behind. And when we look at the, by disease category or population, what we see is that we've left a significant number of people behind in almost all of those different disease categories. And those people have general characteristics that are related to their economic status, color of their skin, sexual orientation. And so as we think about how we are grading ourselves relative to healthcare delivery, I often think about the minority of the people and how much progress have we made for those individuals. I've been in digital healthcare in back-to-back startups to public traded companies, first at Castlight Health, then as the president of Livongo Health. And I think a lot about the progress we've made in the digital healthcare and consumer aspects of healthcare delivery, but we've only really made a dent in a certain population and not a broader echelon. And so I think to really claim victory in our progress, we need to think about the entire population.
Yeah, I think that's incredibly important. Neil?
Yeah, we might be following the same people on Twitter because Deloitte and my team came across the same question, which is this really a problem? Is inequity a problem in health? And so a couple colleagues of mine are in the room as well, Andy Davis and Jay Bott, and we decided to actually tackle this and quantify it. So we put a paper out about 6 to 8 months ago where we actually put a number around it. $320 billion in economic costs because of inequity in the system today, and that's going to move to $1 trillion by 2040. And that was us sizing only 3 aspects of inequity: gender inequity, socioeconomic inequity, and racial inequity. There's a number of other elements of inequity that we didn't even quantify, so the 320, in our view, is the floor. And our view also, as you sort of think about the future of health narrative I offered, which is this early detection, early intervention, we think there's a $4 trillion savings if we can shift to an early detection, early intervention system. So what we're essentially saying is there's $4 trillion to be realized in savings where we actually get in front of health and offer better outcomes and let people be well longer, but 1/4 of that, 25%, is at risk if we don't address the inequity issue. So this is not just a nice to have, this is a deeply important economic dynamic that is in the way of all progress.
I want to build on that because I actually, I'll take it from a segmentation perspective as well. Everyone knows about the silver tsunami. We know this big trend that is happening. And across this, I like to look at it like a triangle, right? So you have seniors doubling by 2040. You have a fragmented system they're doubling into. I manage 4 people over 78, so I love the back and forth, but the amount of specialists they have to see in a given week and a different thing that they're going to, and no one's coordinating care. So it really falls down to a caregiver at the end of the day that's also dealing with kids, dealing with work. 61% of employed people are caring for somebody over 65, and we have a clinical burnout and a clinical shortage. And so you put all these factors together, and there's not going to be enough caregivers, paid or unpaid, to support the group coming in. And now you build on the inclusion issues and the access to care issues. It's a pretty big problem, and yes, I think it really does matter.
Yeah, I think it does too. Obviously, quite a lot, as do the folks here, or maybe you still need some convincing, so let's keep talking about it. I want to sort of, a lot of you have alluded to the fact that there are many different populations being left out, in a sense, and I think typically we tend to focus on the ones that Neil was mentioning, either gender, SES, or racial ethnic inequalities. Those are all incredibly important, and there are others too, and I just want to highlight those. You guys have mentioned a little bit, what are some other kinds of inequity that we need to pay attention to? Like age, I think, because
I think age, and I also think the categorization of understanding what an unpaid caregiver is.
Mm-hmm. Can you say more about that?
Yeah.
Let's talk about caregivers.
So all of you, and I love that. I wish I could see the audience because the lights are so bright we can't. But if I was to ask you to raise your hand, the biggest question I've always had is how many of you are just like looking after a family member that's over 65? And looking after doesn't mean it's a burden. It doesn't mean it's a thing. It's like so many people don't identify with the term unpaid caregiver. Because it's
there are
my
varying
family.
levels, right? There are people who are there day in, day out, actually feeding someone and caring for them in a very physical way. But then there are many other less
And
intense
yet,
levels.
having been in the provider health system for 25 years on the technology side, we're not capturing who the people are, the tribe that is supporting this person. So how do we make sure that's part of the electronic health record? How do we make sure that, when Jenny's team goes out, they know that the sister in a different state is supporting the meds rec on the 5 people that they're seeing? So capturing this audience and looking after them is critical.
Yeah. And do you want to say anything, Jen, about geographic inequity or?
I do.
Diversity?
Yeah, I do. So I kind of led in with rural statistic populations, and maybe I'll just start by saying the percentage of people living in rural markets in America is large, not small. This is not a niche population. When we did Livongo, someone said, "Oh, it's great. Your diabetes." We started with diabetes. Diabetes is huge. It's 30 million people. People living in rural markets are 60 million people, and I still get, "Oh, it's a niche market." When you look at outcomes, if you live in a zip code that is designated as rural by the last three digits of your zip code, your mortality is 23% higher, independent of socioeconomic status.
Wow.
And so there's an equity issue. There's an equity issue in rural markets. And the reason that exists is if you think just about people living in rural markets where they're dispersed, there's lack of infrastructure, there's not a lot of public transportation, there's not broadband connectivity. And if you were to design a healthcare delivery system for that population, it would not look like what we have. So if you ask yourself an inverse question, if you had a blank slate of paper, what would you do to address those health equity issues? You certainly wouldn't make hourly wage workers travel 3 hours in a car borrowed by their neighbor with expensive gas for a 15-minute appointment. And then when they didn't do it, say, "Oh, wow, I can't believe these people are non-cooperative." So you have to change the model often to address access issues and delivery of healthcare system.
Yeah, I'd like to build on your point there and ask others to comment on how, I think, a combination of issues, which is number one, why are some groups being left behind to the extent, sometimes it's obvious, sometimes it's not, but also, since we're at CES in particular, what role can technology play in addressing some of these gaps? Neil, you want to?
Yeah, maybe I'll start here, which is so many of these groups are missed because they are not vocal and don't have the access to vocalize these issues. Or these are the folks that are silently suffering, and in many instances, we don't have the data to track them. So if there's one takeaway that you take from me in this conversation is measurement is everything at the beginning of these types of journeys, and we've not measured it well. In many instances, we've almost shot ourselves in the foot, unintentionally. So, for example, a lot of hospital systems don't track racial identification of incoming patients because the concern was, well, if I know I have, for example, a person of color, they may get a biased experience. But the problem is they're getting a biased experience and I can't track it on the back end.
Right.
Then I can wave my hands as a system and say, well, there is no racial inequity here, which is untrue. You got to measure it. And so I think for a lot of these populations, rural is a fabulous example. That is not necessarily a vocal group. They're not one that actually organized particularly around their health issues in a way that gets amplified within society. So therefore, we don't see it, hear it, and the squeaky wheel does not get the grease. So measurement, and I do think technology matters here, and I know we demonize social media quite a bit, but there are positives about social media, and one of them is the ability to amplify the small into very large voices, especially when done with precision, and I think that's some hope to get energy around some of these issues.
Yeah, go ahead.
Sure. I'll jump in on the technology front. I've been in tech most of my life, and when I think about it, sometimes just because we can doesn't mean we should. And when you think about the noise ratio that comes out of everything we can measure, I think what we have to really stay focused on, where technology can help, is can you actually get the signal-to-noise ratio down? Can you leverage AI and machine learning to figure out trends and things that matter? I think that's where, when we're thinking through how someone ages in place, this is not a Tuesday to Thursday change. This is a month to 3-month change. And so I don't need them to wear something. I just need to be aware of their daily patterns in the house. And we have smart home technology today that even in the rural place doesn't require broadband. It just requires a hub in the house. And so you can start doing things and start wiring environments to understand patterns of daily living, changes in norms. Did I go to the bathroom more often? And maybe there's a UTI in there. Did I slow down? Am I watching too much television? Maybe there's some depression going on there. So there's things that just normal patterns of living can give us that we should lean into versus just clinical data.
Yeah, I'm going to piggyback on the technology, which where we are focused in rural markets. It's a must. It's not a nice to have, it's a must. And the reason it's a must is that the issue in rural markets is there's not enough access to healthcare providers. We're seeing rural hospitals continue to close at alarmingly high rates. And so we need to be able to leverage the technology to scale services and to deliver care to people. So that's absolutely necessary. However, technology alone is not sufficient. So to send a flyer to my 98-year-old grandmother that says, here's a number to call when you're short of breath, she's going right to the trash, right? There's a trust element and a communication and a connection piece that's missing. If she understands who's going to actually receive that information, who's going to be her background and support, she'll use the technology all day long. But we talk a lot about hybrid models and the leveraging of technology, but healthcare is a business about trust. It's about importance for what we want, and so we need to be able to marry those two.
I think that is critical, and this issue of trust, unfortunately, sometimes it's the most disadvantaged populations that have the least trust for technology, and sometimes for good reason. I'm not blaming them, including elderly populations. I don't think a lot of folks, increasingly this is changing, but people are not super comfortable. There's still sort of younger populations. My kids have to help my elders figure out how to use various, you look like you want to jump in on that point.
I do. The elder point, though?
Yeah.
COVID changed the game.
Yeah.
Just changed the game. I can't be on the phone anymore with my elders. Why aren't you on FaceTime? What's going on? Why can't I see you?
Awesome.
So they've adopted technology now because they had to.
They're more comfortable. They're not always comfortable navigating it and downloading it. They need a grandkid for that sometimes, but at least they're open to it and they're interested in it. Neil, what do you think?
Yeah, maybe one quick nugget here is one of our observations is that as technology innovators develop their technology tools, there is an assumption for the most part that that tool or that device or that tech will be used consistently in the same way. To the point being made on the stage, if you're elderly or if you're rural, the way you might engage with the underlying tech actually has to be very different.
Right.
What we found, and you may confirm this or not, but what we found on the rural side is that while you don't have a lot of care providers, the trust in the care provider and that relationship still matters. So it's endorsed tech, and maybe with some intervention, even virtually from someone you trust, that makes the tech adoption more robust in rural settings. That's very different than your 22-year-old tech native who's like, I don't want to talk to a single human being. If you call me, I'm going to kick you to voicemail or whatever, right? I'm going to block you.
Yeah.
Right? So the application of tech is not one size fits all, and I do think that's an inconsistency with what we're seeing from an innovation perspective in the market right now.
Makes sense. So there are a lot of problems here that can seem incredibly large and sometimes even intractable. And I want to sort of highlight for folks a couple of success stories. What are some things that you have done, worked on, that have helped to bridge some of these gaps, whether using technology or some hybrid model with technology and something else? Inspire folks. What good things can we do to address these issues? Who wants to start? You're all smiling. I don't know. Jennifer?
I'm happy to go first.
Okay.
Yeah, as a middle child, I rarely got to go first. So
Okay, you go first.
Leaning in here. I'm actually just going to share a very recent member story that we as a team heard during our team all hands. We were all together and a member had called in and said, this is an older woman. She was in her 70s, living in rural Michigan, which is the market where we first launched. And she was moved to tears because her understanding of healthcare and what she had to do to access healthcare had just shifted with her involvement with Homeward. So prior to Homeward, she said she'd have to get her neighbor. She was on a fixed income, did not have a car. She'd have to hire her neighbor to drive her about an hour and a half to go see her doctor. And our model, we bring care into the home. And for the first time, she said, I can't believe that someone actually cares enough about me that they're going to take away all the things that make it hard for me to go get care to bring care to me. So her understanding, appreciation of that delivery model, I think, was incredible for us.
That's amazing. That's very cool.
Again, I'll share a similar, that's a member story. So we recently launched with the employer, a top 50 employer, and we thought about like how does the employee benefit here? How do they actually like get the support for their elder? And so we figured when we launched this pilot, it was going to be 100 employees, and okay, probably 3 months to get them all onboarded and all of that, like to get the hand raised, get the awareness. In 15 hours, we had 100 hand raisers saying, elder care is a problem. I'm a working mom. I need help to support my parents. We got the technology shipped. We got it into homes. And a month and a half later, it was, this is the best thing my employer's ever done for me. This is making my peace of mind that to know my mom is okay. It's just been phenomenal. And then we saw this 79% reduction in stress and anxiety and better presenteeism. So I think there's opportunities here for things that are not just a technology service for the individual, but for the people caring for the individuals. And the elder loved it because the elder was like, hey, no cameras, no voice, and it's giving my daughter a little peace of mind so she doesn't have to like call me every morning and say, how are you?
I think for a lot of folks, there's the guilt aspect of not wanting to burden others.
Huge.
I love those stories. Yeah, those are great. And the two I'll add to the mix here. So again, from a consulting and advisory perspective, we're seeing this as a very consistent conversation in boardrooms in a way that we haven't historically. And I know the counterpoint is, yeah, it's a conversation of the moment. What's the stickiness? The stickiness is what I'm seeing is the energy and intention happening at the board level is cascading within the organization for those that are oriented around inequity to actually mobilize and get funding to go do things. So I'm actually doing a couple projects right now, one with a client that's an executive within the human resources portion of the enterprise, and they want to go after social determinants of health. So things that sit in front of disease that disproportionately affect those folks that are diverse in whatever way you want to frame that. And we stood up a bunch of pilots to go after that population and see, can we actually move health outcomes, disease avoidance, earlier detection, and or if they are unwell, can we get them the right care faster in a more cost-effective way? That project, I could have been blue in the face. I was not going to engage on that project 3 years ago. And I've got a lot of energy and intention around those things. So you're starting to see the energy and intention at the top cascade into enterprises, and they're getting funded to go do something. So there's hope here, because I do think...
What do you think is motivating that change? Where is it coming from?
Well, I think it's coming from the board, but I think the better question is why do the boards care? And I think the boards care because investors care, and I think investors care because people care, right? So the George Floyd murder and the feet in the street that summer really mattered because it mobilized populations, and it showed that if you were on the wrong side of this issue, you have the ability for populations to come together rapidly and reward those that do well but punish those that don't. And I think investors woke up and said, I'm in trouble if I don't do the right thing here. We can all talk about wanting to do the right thing because it's the right thing, but let's be serious. We know these are businesses. And I think what people realized in that moment was there's an economic cost of being on the wrong side of the inequity equation.
Right.
Get your act right.
Can we talk a little bit about the nuts and bolts about how to build either systems and or products that are more equitable? I think it's really important to distinguish between doing things on behalf of or for whatever population you're trying to help and doing it with that population. There are a lot of folks, I'm sure, here in this audience who are developing tools and or services, and what are some processes by which, particularly since there's such a diversity of folks that being left out, like how do you get different voices into the design or implementation of something?
Yeah, I can start again here. I think what you're mentioning is exactly right. I think we're always in danger if we sit on a stage and say, hey, I know what they need.
Right.
Like that's guaranteed to be a failure. If you need to bring people into and develop a team and a culture that radically listens. Radically listens to the point of almost being uncomfortable. At Homeward, we require that every single one of our employees, no matter what you do, spends time with people in rural markets. So they live. Now, they're not living all the time, but they're seeing and really starting to understand what that is like. And it has been eye-opening. We had one of our designers went out and she said, I met this person and they have a bunch of guns. It's in rural Michigan, a bunch of guns. They had a bunch of ferrets. They locked the door when I was in the house. And I started to become very nervous. I wasn't sure what to do, but it also gave her insight as to why the difficulty of entering into the healthcare system was really hard for this individual, and they ended up developing a nice relationship. But again, the minute we start to say, I know what they want, we're done. You know, it's just a continuous feedback loop and building the culture of listening.
I will agree and jump onto that point, because all of us, we all have elders that we support, so all of us are users. And so I think when you start looking at the solutions that you're putting in place yourself as a user of them, you actually figure out pretty quickly if they meet the need and where the gaps are. And so there was just some obvious, face plant moments where you're like, we did what? Okay, we shouldn't do that. And then now that's a certain socioeconomic class, but we also do a ton of just in more the anthropological research to say like, hey, can I go out and user experience and user-centered design to like live with people, understand them, understand their points of view, and understand like the segments of seniors that aren't tech wary, that are really, they think we're spying on them. They think it's like, Big Brother. And so how do you get people comfortable and receptive enough? And it's only if you know them.
Mm-hmm.
If your team is too smooth, you probably don't have enough diversity on it, as a general comment. And I'll maybe make an observation, not from healthcare, but then we'll apply it back, which is I was watching an interior design show recently, and they were talking about changes in bathroom design, particularly in hotels. And they said, well, what you're seeing, one of these big themes are these rainforest shower heads that sort of drop water straight down. And it's like very luxurious. It's a rainforest. It's luscious, right? But the black male on the panel was like, you know what? I don't get my hair wet in every shower. And frankly, tell me, per the Twitter riff, tell me you don't have diversity in your design room without telling me you don't have diversity in the design room. It's putting rainforest shower heads in every hotel room.
Totally, yes.
Fabulous example, right? It's like you don't actually understand the universe of folks who are consuming your experience, and you don't have the diversity in the room to accommodate. So if that room is too smooth, it doesn't mean you're not reflecting on the diverse needs and the inequity dynamics that are going on, but have a think about it.
Yeah.
If you don't have enough strife and rub in the room and alternative opinions, it might be too smooth.
I like that, and very true. And it's actually really funny because my husband and I, maybe this is too much information, but we have a couple different shower heads in our shower, and I only recently realized like we use different ones.
Yes.
And I was like, no way, because he was anyway. It is fascinating, and it is really important.
It's a great example because we can all relate to it. It's exactly right. It's exactly right.
Yeah. So on this idea of cultures and building teams and encouraging a little bit of discomfort, how do you do that? It's not just about, or is it about hiring diverse people? How do you make that kind of conversation and exchange okay and encouraged? Anybody?
It starts with the process, right? And
Yeah.
so I feel like you have to take the pledge to look at diverse slates of candidates, full stop. It has to be part of your onboarding process. The uncomfortable silence and the diverse nature, I think one of the challenges, and we're open about facing it, it's when we all went virtual, oh God, Teams and Zoom, it's really hard to really look at people and say, you had something to say, jump in there and get into a scrum. And so I think it's also how do we bring different ideas up, either in a prose, in new opinions, or even bring discourse to who in the room is now going to do the opposite point of view, and let's make sure we're looking at everything from all angles. So
Cool.
different tips
Anybody
and
else have
tricks.
thoughts on that?
When I'm coaching peers and others in terms of the interview process, I think one of the observations we've had is that folks tend to hire folks that remind them of themselves. I would argue that is exactly the wrong way to go when you're thinking about diversity. You don't need another one of you. You got you. You're already in the room.
Exactly.
Right? So bring that perspective and be rich in that seat. Great. I think the better
They're
interview
not going to
process-
help you.
No.
They'll just run around and do what you do, which is great. But please, you need somebody who does the things you're terrible
sees it
at, and
differently,
vice versa.
right? Who sees it differently. So I would say where you have somebody that offers a set of different perspectives that they can defend and that open up possibilities in your head, that feels like a much richer person to join your team as opposed to someone that agrees with everything you say. Right?
I also think there's this component of cultural leadership that requires active listening and active involvement. So oftentimes when you're in a minority position, for whatever reason that is, you're less forceful in maybe what you say it differently, you caveat it, or you don't say it at all. And so I think the onus is not necessarily on those people. The onus is on the team, the leadership, one, to bring people in, but two, and more important than just bringing them in, is to make sure that they have a voice and make sure that the questions are asked across the ecosystem, not just the two people who always speak up, who always agree with you, but that you're listening to all the voices to inform the decision making.
And that might include maybe gathering input in different ways, not just in an open meeting session in which some people might feel uncomfortable speaking.
I was going to go there. Which is, so in some of our teams, what we do is we have everyone brainstorm before the meeting and write the ideas down, and then you show up in the meeting to speak to it. Because what we found is if everybody has a brainstorm openly, you congeal around the person who makes the most money in the room.
Yeah.
And that's
Oh,
the idea
no.
that ends up getting voted up. And so what we found with organizations is do the brainstorming quietly on your own and then bring those ideas. And then you're in a position where you have to defend what might be a really out of left field idea, but that's where you get really interesting stuff.
Yes, you also kind of force people to engage with the ideas
Yes, you
first.
do.
So we've got about 10 minutes left, and on the theme of bringing in diverse voices and not assuming what you don't know, we want to open the floor up to you guys. If you do have any questions, as we've mentioned, it's a little hard for us to see you, but I believe that there is a mic somewhere up here toward the front. Any folks, do we have any questions out there? Maybe not. It's a little hard to see. If anyone does have questions, I encourage you to come forward. I will at least see you, and we can figure out the mic thing. All right, I see somebody in the back moving forward, maybe a couple folks. Good.
Hello.
Hi.
So this mic is not in a opportune visual
Yeah, no, it's really
location. Yeah. So I'm gonna try
not. I believe you're back there.
Yeah, I'm gonna take it. I'm gonna walk back. So
Can you just give us your name, please?
Yeah, sure. Now I was about to start with that. My name is Fritz Desir. I represent a venture studio called Awesome, which is we focus on health and wellness startups. So we essentially build startups. I'm a recovering consultant just out of BCG about 8 months ago.
Congratulations.
And and then McKinsey before that. So, and one of the startups we're working on is focused on health in a very specific way. Essentially, sort of like a personalized care concierge to help connect the dots between things like making medical appointments to having a solution like Quill Health in someone's home. Because what's happening, there's a bunch of different solutions that are out there that the average person doesn't know exists, right? So when they're trying to actually figure out, like I lost both my parents the last year and a half, and I went through a bunch of different things dealing with their sort of transition. And I'm in the space, and there was a bunch of solutions. Like I never heard of Quill Health until today, right? So they're just, I was doing Life Alert and, just whatever I could find because I'm busy, I'm a consultant, I don't have time to research. So the solution we're doing focuses on like connecting those dots on the tech side and on the like qualitative health side. But my question is, how did you all find sort of integrating with the existing system, right? Because I think, except for, is it Neil? Yeah, except for Neil, who's more on the consulting end, the two of you are sort of, we're developing solutions. There's existing healthcare system that we have to integrate with somehow. And I'm just curious, like, is there any advice that you have for us out here on how to do that? Because that could be a real breaking point for a lot of digital health startups that just run out of money trying to figure out who's going to pay, how do I, we found out we can't work with payers, at least not yet, so it's private pay, like just navigating how to get into the home from a business perspective and how to deal with the existing systems that surround that. Like that's my, does that make sense? Like, yeah.
It does. Yeah, so our business and I have a fundamental philosophy that if you're really going to make an incremental large shift in healthcare, you have to work within the ecosystem. You have to bring something that has value add to the existing ecosystem and partner. That's true in spades in rural healthcare, right? We can't come in as a competitor that would, not give us the outcome we want. But in order to do that, you have to understand the economic incentive across the ecosystem that you're coming in. That's saying that it's really hard to get somebody to do something when their job that pays them depends on them not doing it. I would say that the fortunate thing in healthcare is there's so much waste and there's so much need for economic alignment that you can almost always find something that's a value add across the ecosystem. But as you're designing your solution and going into market, designing with that principle, I think is important.
I think building on that as well, looking at the ways for efficiency in the system, and we've designed our solution to basically add eyes and ears to clinical care by empowering then the non-clinical unpaid caregiver. And so in your scenario, right, when you're thinking about this, you became like Dr. Google PCP, navigating for your parents, trying to do all of those different pieces. And are there certain trends that we could have detected that were important to you to then inform a practitioner that really wasn't clinical data? So I do think, back to my earlier comment, just because you can doesn't mean you should, unless you follow not only the economic model, but the clinical workflow model of what actually matters to a care manager. What could they alert on? What matters to a clinician or a front clinician coming into the room to do the triage? So if it's not making their lives more efficient and looking at populations at a broader scale to drill down to an individual, then it's just more noise in the system.
Fritz, I know you told me not to answer, but if I may. If I may. Yeah. Well, and that's exactly where I was going to go, which is I work with a number of large enterprises, and their question to us, through our Future of Health lens, we think of this as a mass fragmentation moment. Lots of startups, lots of fabulous ideas, but it's very hard to parse what the standards are going to be, who are the winners going to be, who do you align with, and if you're a large incumbent, who do you partner with, who do you acquire, who do you ignore? It's really chaos out there, and we're spending a lot of energy with our clients working on that. One of our observations, and this is sort of a broad brush, is a lot of startups get preoccupied with the technical solve, and they do not spend enough energy on the business model, commercial model. And it's a general observation, and it's even more particular for technology-led solutions. And so, as we work with organizations and bring them in, you see business model revamp aggressively as our clients are buying or partnering, because the model that went out there didn't necessarily have a robust underpinning that could justify the investment and the growth that was being aimed for, hoped for. Hopefully that was, thank you.
Good answer. I definitely have seen a lot in the startup world. People have a hard time navigating payment within healthcare. As you guys all know, the incentives are really complicated and a very long sales cycle often, and it can be difficult if you want to be consumer-centric, but that's not always where the money's coming from. Any other questions out there? I think we have time for one last one. All right, come on up.
I'm Andrew Linscott. I work for 3M Health Information Systems design team. In the past couple years, accessible design solutions, digital design solutions has become more of an important thing for us as we develop software. I was hoping you might be able to speak to any insights or things that you've found for proving out, especially communicating with business partners around proving out the value of building in those accessible solutions for patients as well as providers.
Sorry, maybe just say a little bit more about the question. So when the value you create for patients and providers, how do you share that message broadly with the ecosystem?
Yes, with building in accessibility into the digital solutions to make sure that they're servicing marginalized groups adequately and communicating that value to business partners who may be a little bit more resistant to maybe not recognize the value of addressing these solutions and how those can actually benefit a wide variety of folks.
I mean, I'll come back to my measurement theme just personally, which is, it's one of the lenses we put on technology rollouts now, is a look at through an equity lens. Are there biases played out as this technology moves forward, and how are you able to quantify those? What are the actions you're taking, right, et cetera? So that's a lens that we're putting on it. Frankly, if I'm being frank, I don't see that approach being used broadly in the industry right now. And that is a frustration, frankly, for us.
Well, and I think the more we can actually empower in the data sharing and the consumers owning their care, when you start thinking about this, now segmentation becomes really important because it's not really one size fits all, or even there's this concept of that, can you really design for every population? Understand the value you're providing for the specific population and make sure that it meets their needs and is accessible to that in all of the intention that you had. And then it's, in most things, I think, Jen, you've been in the startup world forever. It's crawl, walk, run. Like, you have to start with populations and then expand from there.
Great.
Thank you.
Well, I want to.
Andrew.
Yeah. Anything else?
Just thinking.
Okay. We are about at time, and so I would very much like to thank our panelists, Jennifer, Neil, and Karina, for your insights. And I would hope that all of you, when you run into those folks on social media or elsewhere who say, why does this topic matter? Why is diversity and equity and inclusion a thing? Now, hopefully, you've got a lot more tools to answer that question and to build to close those gaps, in the work that you do every day. So, thank you.
Thank you.
Thank you.